Okay.
I know you will. So we've got a lot of information today. How many of you all saw the testimonies that were in the IMAX of the different people who had the different diseases? Just wanted to see just how many of them. Okay. So stroke, that was my husband. For those of you who saw that was my husband. I was the one who took him to the hospital. What he failed to tell you is how long it took me to convince him that he was having a stroke. Stroke is really a brain attack, and that's what I want you to think about. We all know about heart attacks, but a stroke is a brain attack. Your brain controls your vision, your movement, how you swallow, your muscles, your respiratory functions, your cardiac functions. All of that is controlled by the brain. And the vessels, this was excellent of you showing those vessels. The vessels will provide blood to the brain. Now, if you do not get enough blood flow or oxygen, that will cause your brain not to function correctly. So there are two types of strokes. One is the ischemic stroke, which is where there's a decreased amount of oxygen that goes to your brain, and that's normally due from a clot. And as they showed, it can be just the size. My husband's size was the size of a pinhead. Very, very, very small, very small clot, the size of a pinhead, that can cause the stroke. 87% of the people have ischemic strokes. The other is hemorrhagic stroke, and that's when you have a leakage of blood. And fortunately, maybe about 13% of the people have hemorrhagic strokes. So stroke is the third leading cause of death. And every 40 seconds, somebody is having a stroke. So every 40 seconds, somebody has a stroke, and every 4 minutes, somebody dies of a stroke. It's the leading cause of disability in the United States. It causes about $54 billion is being spent from stroke in healthcare, in medications, and also the inability to go to work. As my husband had mentioned, that his fear was having another stroke, because you have about 60,000 people who have a stroke a year, and close to 200,000 will have another stroke within that year. So I would always hear from him, because he was always on the internet, and I kind of made the misfortune of letting him know, well, you got a 10% chance. That was my fear. You have a 10% chance of having a stroke, and I said something to him. That was the worst thing. So he was very fearful that he was going to have another stroke. So every little thing that happened, he was wondering, am I having another stroke? So what are the risk factors? Dr. Brown touched on every last one of them, and it actually started with Dr. Ford. Your risk factors: your blood pressure, diabetes, high cholesterol, smoking, inactivity, and obesity, age. Now, again, there are some things that we can not control, and we cannot control us getting older. But we can really control everything else. What my husband failed to tell you all in that video, he was diabetic and he's hypertensive. And he took a lot of medications. But he would not always take the medicines because he felt like he was feeling okay. He was also in denial because he said, I don't smoke. He's never smoked in his life. He does not drink. He didn't feel that he was really overweight, so he thought that he was okay. But he did not take it. He was not taking his medication, or he'll take the morning dose but not the evening dose, or he'll take the morning dose later. And sometimes he just wouldn't take it at all. So he was not always your best compliant patient. So those are some of the risk factors that you can have. So what are some of the signs? Some of the signs drooping on the side of the face or difficulty with speaking. You're having that slurred speech. Weakness is always usually on one side of the body. You can have problems with your vision. You can be dizzy. You can have a headache. It's not always something that's just a massive stroke. So you can have some of those signs. And one of the things is called a TIA, transient ischemic attack. That's when you have like symptoms of a stroke, but all the symptoms go away within 24 hours. When you do have a TIA, you are at risk of having an actual stroke within a minute. What can you do? The important thing is to recognize a stroke, not just for your own personal self, but you might be around somebody who has had a stroke. And when I practiced emergency medicine, I saw so many people who had symptoms for days and thought it will go away. Or they thought, oh, I'm just tired, I need to have some rest. And they will go to sleep and they will wake up and the symptoms are still there. And they will get progressively worse. So the thing is to be able to recognize the symptoms. So when you hear somebody speaking funny, or you see somebody who is having difficulty with their balance, or if they're just saying, oh, I'm just a little dizzy, or they're sitting there and they got the little droopy face and they can't smile, and you ask her to smile. Like my husband, I said, smile. He was like, what's wrong with you? See? And the whole side of the face was just down. You call 911. They have to get to the emergency room because most of the time the causes of stroke is from a clot. There's medication that can be given to try to break up the clot, to open up that blood vessel, to get that blood flowing to the brain so a person will be able to recuperate the functions. But it has to be done timely. It can't be done if they wait throughout the night, they can't get that medication. So it's important to be able to get them into the emergency room in a very timely fashion. And that is something that you can be able to do. And then let's talk about just prevention. So these are really, I'm going to be repeating some of the same things. One is that you can do is to control your blood pressure. Know your blood pressure. As Dr. Ford said, you're not going to have any symptoms, unfortunately. What brings people in the emergency room? Pain and blood. And blood pressure gives you no pain. It doesn't cause you to have difficulty with breathing. You're just fine. You're walking around with high blood pressure. So check your blood pressure. Go to the CVS. They have those blood pressure cuffs there. Just check your blood pressure. And also see your doctor. Get your blood pressure checked. If you're a member here at the church, we check blood pressures on the second Saturday of every month at the ministry center. So that's something that's free of charge. If you smoke, stop smoking. But no one here smokes, so we can move on with that. We need to lose weight. Let's try to at least drop 10% of our body fat. That is so important to be able to lose weight and to make these lifestyle changes to get the weight off. Is it going to be easy? No, it's not easy. But it's something that you want to be able to really try to save your life. So go ahead and lose the weight. And I'm putting a plug in here. We have our FBC Weight Loss Challenge, and we're going to be able to help people to lose the weight over the next 6 months. So, please go if you're interested in really trying to lose weight. Go to the downstairs and sign up for the challenge. Manage your diabetes. As Dr. Brown says, no one dies from diabetes. They die from the complications of diabetes. And it's because they're not managing it. So manage your diabetes. Check your glucose level every day. Take your medication. Get your hemoglobin A1C done. That's to let you know how control your glucose is over a period of time. Get active. You just have to do something 30 minutes a day. It's not going to the gym. It could just be doing just walking a little bit, but you have to get active. Improve your diet. the things that are worse for us, unfortunately, taste so good. You know, I love cookies and cakes. You know, those are the great difficulties for me. I am a fast foodaholic, so I stay away from the fast foods. So those are the things that you have to really control your diet. And as Dr. Rose said earlier today, you know, put some